Understanding Medicaid. Medicaid is a joint federal and state health insurance program for people with low incomes, families, pregnant women, seniors, and individuals with disabilities. It covers doctor visits, hospital stays, prescription drugs, preventive care, and long-term services such as nursing facility care. Around 83 million Americans rely on Medicaid for essential health services. Proposed scale of cuts. Legislative proposals aim to reduce federal Medicaid spending by at least $700 billion over the next 10 years. The goal of these cuts is to offset tax cut extensions and reduce the federal budget deficit. Independent estimates project that such reductions would lead to millions more Americans losing their health coverage. Mechanisms of the cuts. Work requirements. Adults between ages 19 and 64 would have to work, attend school, volunteer, or meet other exemptions for 80 hours each month. Meeting these rules would become a condition for maintaining Medicaid eligibility. Reduced federal matching. States that expanded Medicaid under the Affordable Care Act could see a lower federal matching rate. This would shift more costs onto state budgets and might prompt states to roll back expansion or tighten eligibility. Caps on provider taxes. States use taxes on hospitals and other providers to draw down additional federal dollars. Limiting these taxes would reduce the revenue available to support Medicaid providers. Coverage loss estimates. Independent analyses suggest that cutting Medicaid funding on this scale could result in 8 to 12 million more uninsured people by 2034. In deeper cut scenarios, up to 20 million could lose coverage. The exact number depends on how individual states respond to reduced federal support. Who will be affected? Children and families. Medicaid covers roughly 40% of all children in the United States. Reducing eligibility thresholds or imposing new paperwork requirements would risk pulling coverage away from many low-income families, jeopardizing preventive care and routine immunizations. People with disabilities and seniors. Medicaid finances the vast majority of long-term care services for seniors and people with disabilities. Cuts would threaten access to in-home care, assisted living, and nursing facility services that most families cannot afford privately. Working-age adults. Many adults in low-wage jobs depend on Medicaid because they have no employer-sponsored insurance. New work rules and funding reductions could push these workers into uninsurance or leave them unable to afford treatments for chronic conditions. Impact on healthcare providers. Rural hospitals. These facilities often operate with thin financial margins and rely heavily on Medicaid payments. Reduced funding could force closures or reduce services, leaving rural communities with limited emergency and specialty care. Hospitals and nursing homes. Cutting supplemental payments and restricting provider taxes increases uncompensated care costs. Providers may respond by cutting services, raising prices for privately insured patients, or closing less profitable units. Economic and budgetary consequences. Reducing Medicaid by nearly $1 trillion over 10 years could slow overall economic growth, cost hundreds of thousands of jobs, and force states to balance their budgets by raising taxes or cutting other programs such as education, infrastructure, and public safety. State revenue gaps might lead to average tax increases of around 4%, with some states facing far higher rates. Broader health and social impacts. Beyond coverage numbers, these cuts risk worsening health disparities, straining mental health and substance use services, and increasing reliance on costly emergency care. Services often lead to more severe illnesses later, driving up overall health system costs and deepening financial hardship for families. How cutting Medicaid becomes a tax cut for the wealthy. One budget trade-off. Lawmakers want to extend or deepen tax cuts without raising new revenues. To satisfy budget rules, they look for savings elsewhere. Cutting federal Medicaid funding supplies the hundreds of billions of dollars needed to pay for larger tax breaks. 2. Medicaid as the chosen target. Medicaid serves low-income families, seniors, people with disabilities, and pregnant women. Because it is jointly funded by Washington and the states, and because its beneficiaries lack strong lobbying power, it becomes an easier program to reduce than more popular ones. 3. Converting Medicaid savings into tax breaks. A. Congress identifies a total reduction in Medicaid spending over a 10-year window. B. Those reductions are counted as budget offsets, which under reconciliation rules allow new legislation to avoid raising the federal deficit. C. With the offsets in place, lawmakers can approve large tax cuts that primarily benefit high-income households. 4. Who gains from the tax cuts? The top 1% of earners receive the largest dollar amounts, often tens of thousands of dollars annually, because they face the highest tax rates on wages, dividends, and capital gains. Households in the top 20% also enjoy substantial savings, since they earn enough to qualify for larger rate reductions and itemized deductions. 5. Who loses from Medicaid cuts? Low-income families lose access to doctor visits, preventive screenings, and long-term care. The value of these benefits often exceeds any small tax savings they might realize. People with disabilities and seniors for whom Medicaid pays nursing facility or in-home care face higher out-of-pocket costs and may see services reduced or eliminated. 6. Effect on economic inequality. Shifting hundreds of billions from a program that helps the poorest into tax cuts for the richest moves money up the income ladder. High-income families keep more after taxes, while low-income households lose vital health coverage and face greater financial risk from medical expenses.